Welcome back to Therani, I'm Joe B. Today I'll show you how to correct a posterior pelvic rotation through a muscle energy technique and exercises. Let's dive in. Pelvic or iliac posterior rotation is when the ilium gets stuck rotated backward. The cause of this can be due to repetitive cutting and excessive trunk twisting, which can result to the anterior superior iliac spine, or the ASIS, to be higher on that side. In addition, the left lower extremity will be shortened. There will also be left sacral rotation. And since the lower lumbar spine stays in neutral, it would seem like it rotates to the right. Iliac posterior rotation can bring about low back pain below the belt line in a rectangular pattern. Running, walking, and stair climbing can increase it. And patient can feel off kilter during walking due to a leg length discrepancy. The assessment for iliac posterior rotation requires the patient to do bridging first to balance the pelvis and then be in supine with hands at sides. The therapist will be at the foot of the table with both hands at the malleoli such that the thumbs are on the medial malleolus, while the lateral four fingers will be at the lateral malleolus. From there, the therapist passively extends the knees to check for malleolar symmetry. Normal findings is that the medial malleolus will be symmetric in supine and long sitting. Abnormal findings is that the left lower extremity is shorter in supine but becomes symmetric with the right lower extremity in long sitting. To treat, let's assume that the right side has the iliac posterior rotation. The patient will be in prone with treated ilium close to the edge of the table. The therapist is on the treated side with the left hand cradling the patient's right lower extremity through the knee, while the right hand is placed 2 inches anterior and superior the posterior superior iliac spine, or the PSIS. The therapist abducts the right hip by 20 degrees to loose pack the sacroiliac or SI joint, then extends the right hip while the right hand exerts force towards the iliac crest to cause anterior iliac rotation. Once limitation towards hip extension is felt, then the patient is instructed to press the right knee towards the therapist's left hand for 6 seconds. Then the hip is moved further into extension with iliac anterior rotation pressure. This process is repeated for 5 reps. Sit-to-stand exercises can be provided for the patient to reduce or eliminate the likelihood of iliac posterior rotation recurrence, since standing promotes hip extension, which stretches the anterior hip structures and pulls the ilium into anterior rotation. This is performed for 2 sets of 10 reps. You can also perform a hip flexor stretch for 3 reps, 30 seconds each, as it attains the same iliac anterior rotation mechanics that counter posterior iliac rotation. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.